Hi everyone, I'm going to record this lecture on research approach part 1, which will focus on quantitative. And this particular lecture will give you a guideline of what is expected in approach section or methodology section of a proposal and what level of details is expected in that each subheading within that section. So research methods, generally we will cover study type, study setting, study population, data collection tools and techniques, data management, detail of data analysis and limitation. And we will describe each of these components very clearly in the proposal. So I'm going to start with the example of the Nepal Pioneer Worksite Intervention Study that was conducted in Dhulikhel Hospital. The aim of this study was to measure the effectiveness of a lifestyle intervention compared to usual care on HbA1c, glycated hemoglobin levels among employees of Dhulikhel Hospital. HbA1c, you might all know, that is a biomarker for high blood sugar levels in an individual. So let's start with a quick overview of study types. Generally, like broadly, study designs can be categorized into quantitative design, qualitative design, and mixed methods. And as I told you previously earlier in this lecture, that we will be focusing on quantitative methods for this specific session. So quantitative methods can be broadly categorized into intervention and observational study. Intervention can be a randomized study or a non-randomized study. For this lecture, I have incorporated an example of a randomized control trial. The observation studies can be either a cross-sectional study, case control study, cohort study, nested case control, or case cohort study. There are also other variations or other categories of observational study, but these are the ones that are mostly used in the field of public health. So as I said earlier, I'll be focusing on what should we be reporting or writing in the proposal in research methods section. And within the section, like each subheadings details. So for example, the study design, we wrote that we will conduct an unmasked 2-arm randomized trial by allocating half of the participants to lifestyle intervention, while the other half of the participants will receive usual care, and figure 1. So we've also provided figure 1 in this studies, and then I highly recommend to always include a flow chart or a design chart for a randomized trial. So for example, in this study, we were targeting to screening 700 participants, and out of those, we hope that 366 would meet the eligibility criteria, and then we would randomize them into a lifestyle intervention or a usual care. And then after 6 months of receiving the intervention, we will measure the N9 measurement. So this is a very clearly written study design with the figure. However, you can also just use a simple sentence for other designs. Like for example, you can just write, this is a cross-sectional study looking at association between this dependent variable and that independent variables, or you can also say that this is a longitudinal cohort study, or this is a case control study. But always be sure that you are clear about your study design. And the second subheading is study setting. In the study setting, always mention the name of the place, which would be very straightforward, and then give the characteristics of the setting, whether the setting is a study was conducted in an urban or rural setting, in which kind of population, whether that was a specific marginalized, disadvantaged population or general population, just male, female, or LGBTQ community, or like any specific type of population, and give the relevant information related to study. So another question that I usually get is like, how detailed should we go? And it totally depends on the audience. And then most of the times when we are reporting to international journal, we might be starting with, okay, the study was conducted in South Asia. There is a country called Nepal, and then give more detailed or specific information about the study setting. But if we are like, for example, in our setting, if we are the audience, then we don't need to talk in general about South Asia or Nepal. We can just directly get into Dhulikhel or any municipality that we are conducting study in. And we also present the relevant information that is related to our specific objective. So for example, if we are conducting a study on HIV/AIDS, then we can provide information such as, in this geographical area, there are these many people living with HIV/AIDS and these many ART care centers and these many health care providers who have been trained in HIV counseling and so on. Or if we are conducting a research in reproductive health, then we can state that, okay, this geographical region has like this many women who has recently delivered, this many expected deliveries in a year, and this many institutions that have been certified as a birthing center. So it will totally depend on what kind of study you are doing and what is your specific aim. So for this study, we have explained the study setting in terms of where the study was conducted. So we wrote that the study will be conducted at Dhulikhel Hospital, Kathmandu University Hospital in central Nepal. So this article was published in BMJ, so we decided to give a little bit of broader context, saying that the Dhulikhel Hospital is in central Nepal. Dhulikhel Hospital is an independently owned, not-for-profit institution which was conceived and supported by the Dhulikhel community. The hospital has approximately 1,040 employees, 4 cafeterias that are in operation 16 hours a day. There are no gyms or other facilities to help physical activity on site. The hospital does not currently offer any wellness program for the prevention of cardiometabolic disease. So if you link this setting with the specific objective, the specific objective of our study was to look at the effectiveness of a lifestyle intervention on the diabetes or HbA1c level among employees of Dhulikhel Hospital. So we are giving that context to the audience as well. So we are talking here about what kind of hospital this is, what kind of food services are available, what kind of physical facilities for physical activities are available, and what kind of other wellness programs are available. So this information will give certain context to our study specific objective. When we talk about study population, the choice of a study population should also be justified in terms of our specific objective. And then we will clearly mention like how will we recruit the study population, who will be recruited, and be very, very clear about what is the inclusion criteria and what are the exclusion criteria, and also the ethical considerations that we will follow while recruiting and dealing with our study population. So here, for example, we said that we will conduct a 20-minute session in all of the hospital departments. Employees will be invited to attend session by flyers posted around the hospital and through announcements in department meetings. During the information session, we will explain the purpose and the expectation of the study. We will explain the ethical considerations, emphasizing the importance of protecting participants' privacy during study-related interactions and outcomes, the volunteer nature of the study, the option to drop out of the study at any time, and we will establish that there will not be any coercion from supervisors to participate in the study. So this is all we are talking about, how we are going to recruit the participants in this study. After the information session, research assistants will set up appointment for eligibility screening among interested participants. So it doesn't matter what kind of study you are doing. So we are looking for, readers will be looking for this kind of details of about how we recruit our study participants. And then again, I would emphasize that, like, be very clear about inclusion criteria. So for here, we are saying that the inclusion criteria are adults, 18 years or older, full-time employees, those who have systolic blood pressure of more than or equal to 120 mmHg, or diastolic blood pressure of more than or equal to 80 mmHg, or HbA1c of 5.7 to 6.4, or fasting blood sugar of more than 100 mg per dl. So when we decided on this inclusion criteria, it is also directly connected with our specific objective, because we wanted to lower the glucose level or HbA1c among those who are at high risk of developing a diabetes. So these people are at high risk of developing diabetes. So we are gonna recruit only these people in this study. The exclusion criteria are pregnant women, since dietary habits may change during pregnancy, those who are taking diabetes medication or taking hypertension medication. Those employees who are taking medication receive free drugs and lifestyle counseling in the hospital's diabetes and hypertension clinic. So when you mention your inclusion and exclusion criteria, make sure that the same thing is not repeated. So for example, you've already said that we will include adults who are 18 years or older. So no need to say in your exclusion criteria that people younger than 18 years will be excluded, because it has already been clarified in your inclusion criteria. And also there is a very common tendency to write like, we will only include those people who provide informed consent, or we will only include the interested participants. So there is nothing wrong with that, but it is very clear that it's not ethical to include those people. So it's not necessarily important to kind of mention it within your inclusion or exclusion criteria. In terms of ethics, we would also mention very clearly how the ethical standards are maintained. So here we have said that the RA will obtain written informed consent in a private room for those individuals who are deemed eligible to participate in the study. And a short oral consent process will be utilized for participants who cannot read the consent form. So it is also very important to specify how will you guarantee the safety or ethical considerations for those people who are not able to read and write. And there are different options for that. So one is to just do a short oral consent. While you do oral consent, nowadays Nepal Health Research Council is also mandating or requiring that you record the whole consenting process as an evidence that you did get an oral consent. Another option is to have a witness with you, and then while you read the consent form, make sure that the witness who can read and write would make sure that the illiterate participant has understood all of the things that has been written in the consent form and agrees to participate, and we would get the signature from the witness. So now we move to data collection. In the data collection, think about what do you collect and how to collect that. So list all the variables that you are going to collect in your study. And are the data you propose to collect the data you need to address the specific objective? So think very carefully about that. So don't just get a list of variables that has been collected in other study or a similar study. Just think a little bit beyond that, and then be more mindful about like what variables you actually need to answer your research question, and how do you collect those variables. And if you are collecting other data, like sometimes as a researchers, we kind of tend to collect more data because we don't want to miss that opportunity. Usually in larger studies, people collect much more data than their specific objective, so that they can utilize their data for further to answer another research question. But for the purpose of master's thesis, unless you are really, really interested, I would not suggest you to collect more data than you need. And then if you are collecting more data, then you have to get ethical approval for that, but it is not necessary to include it in your thesis proposal. And in terms of how to collect data, we would have to report both the technique and tool of the data collection. So let's talk about what to collect. Think about classifying your variable types based on your specific objective. So think about what is your independent variables. Those typically we consider them as an exposures or risk factors in epidemiological terms. What would be your dependent variables? There can be more than one dependent variable as well. Those that we also term as outcome or endpoints. And what are the other covariates? That covariates will mostly include the confounding variables that you would expect to confound the relationship between your independent and dependent variables. So here are some examples of variables. So for example, the demographic variables would include age, gender. Lifestyle variables will include smoking, exercise, diet. Physical, medical history would include like history of having cancer or surgery. Work history, for example, job exposures or duration in the job. Family history. Physical examination that might include blood pressure, weight or height, or biochemical parameters that can be measured in lab. When you are thinking about the variables in your study, think about what would be the technique and tool to gather the information of that particular variable. And in terms of techniques, you could use interview using a tool such as interview guide or questionnaire. You can do self-administered using questionnaire. You can collect data from medical records using some abstraction form. You can also collect data from registries such as like cancer registry or like MI registry using your checklist. You can measure your weight using a weighing scale, measure height using a stadiometer, measure blood pressure using a BP instrument. And when we are thinking about the tool, always think about validity and reliability of that tool. So when it comes to validity and reliability, this DART charts is very famous to explain this. So I'm gonna try to use it to explain it one more time. So let's assume that the red one is the truth that we want to measure. So, and then the first picture is reliable but not valid. So that means we are measuring our metrics, whatever variable it is, we are measuring. Every time we measure the same thing or similar thing around the same thing. So this is reliable. That means when we measure, our instrument is able to measure the same thing over and over again. But this is not valid because what we want to measure is the red dot, but what we are measuring is something far off from the red dot. So that means our instrument is not valid but is reliable. So second picture is valid and not reliable. So you can see that every time we are measuring somewhere like around this whole circle. And then one time we also measured like a very close to this red circle. So our instrument may be valid. Sometimes it may be valid, but it is not reliable. So this is the third picture. So we are measuring our metrics different every time, and then it's nowhere close to the red dot that we want to measure. So this is neither reliable nor valid. And this is what we are opting for. The last picture is we want to measure the red dot, and then we are measuring the red dot every time we measure it. So our tool is valid and reliable. So in practice, what we look for a previously used, well-characterized questionnaire or tool, and then the assumption behind that is, okay, if another person has used it or some other authors have previously used it, then it might be valid and reliable. But I want to encourage you to just go to the source document and then verify that the tool has been tested. When we use new instruments based on other instruments, so what we do many of the times we do is there is a valid questionnaire or instrument that has been validated in a different population. For recently, we used a cancer stigma scale, and it has been validated in like Japanese population, Chinese population, British population. So we adopted the same instrument and then translated into in Nepali and use that. So that is also another common practice. If there is no valid instrument available before, we would just develop a new instrument based on the need of our study and literature review, and then we validate it by our pilot study. And then sometimes we use new instrument and validate it within the study, like we do a pre-test of those instrument and then validate it. So when you are planning about data collection, think about participant burden. You don't want to bore the participant, because if the participant has to spend long time with the interviewer or with the researcher, then expect that the quality information is not coming. So by the longer the duration of the interview or duration of the data collection, the quality of information will wear off. Think about cost, especially for the master's thesis. Costing is very important. You want to make sure that you would be able to do this study. Invasiveness, so how invasive the procedure is very important. There is much more ethical consideration when you are using an invasive process compared to those when you're not using an invasive process. So be very selective about it. What are the risks of participation to the participant, and how will you weigh it? So what kind of questions you would include in the study if you don't have, or if you don't need some certain information but is kind of high risk to the participant, then you would make sure that you don't collect that information. And make sure that you get what you need, right? Because it will be very hard to go back to that participant and get further information. So just make sure that you have listed all of your variables, you have like valid and reliable tools that you are using for that, collecting that information, and then you don't have to go back later. So here is the example of what to collect. So there is the list of the variables that were collected in our Nepal Pioneer Worksite Intervention Study. So for demographic information, we collect, say, age, sex, ethnicity, education, income, religion, and marital status. And don't write etc or etc in this list. So we need to present the complete list and not miss any variables that we will be collecting in our during the data collection. So in the anthropometry, we used height, weight, waist circumference, hip circumference. We measured blood pressure, we collected information of lifestyle factors, and here we said 24-hour dietary recall for the diet, global physical activity questionnaire. It's a validated tool to measure the physical activity, smoking and drinking habits. And then we also drew the blood samples and did these many tested. So HbA1c, which was our primary outcome or dependent variable, fasting blood sugar, SDL, LDL, triglycerides, and total cholesterol. And then in this study, we also mentioned which variable was collected in which month. For the cross-sectional study, or if you are collecting this for a one-time study in case control or quad study, then you may not need to give this kind of timeline. So for the data collection, we also are expecting, or readers are expecting, to have a very detailed method of how we are collecting the data. So for example, for the socio-demographic information, we have written that research assistants will interview the participants using a standardized electronic questionnaire using Open Data Kit software. RAs will receive 2 weeks training on data collection and ethical issues. Very important to mention that the RAs will, how much rigorous training the RAs are getting. The questionnaire will assess socio-demographic characteristics and then give the comprehensive list: age, sex, ethnicity, religion, marital status, annual income, education, and lifestyle factors, including smoking, alcohol intake, and physical activity. So these were all included in one standardized electronic questionnaire. And then we are also using a specific questionnaire, the global physical activity questionnaire. So whenever you mention about a specific validated questionnaire, you always want to give the reference of that. Reference of the article that is reporting the development or validation of that particular tool. And then we said that we would calculate the maths minute per week using that tool. Another example of diet, collecting the diet information. So a 24-hour dietary recall is a very, very specific method to collect the dietary data. So we gave a very detailed information about that, and here is the reference for that, the reference number 17, and this is the reference of article that outlines like how exactly should we measure the 24-hour dietary recall. So each 24-hour dietary recall will take approximately 25 minutes to complete. First, activities of previous day will be documented to refresh participants' memory. Then a dietitian will ask participant to recall everything he or she consumed from the first meal to last meal. The time and place of each meal will be noted, followed by detailed information on each food, including specific brands, ingredients, and or recipes. So in this way, we will give the details of if you are using a particular way of collecting data. The another example of collecting the blood pressure information. So we would write like give a very specific information about how we collect the blood pressure. The blood pressure will be measured in a right arm of seated participant after 5 minutes rest period. 3 measurements of systolic and diastolic blood pressure will be taken using a micro-life automated blood pressure measuring device. So always make sure that you mention what tool you are using. The mean of 3 blood pressure was used for the data analysis. For the anthropometric information, so we would say that body weight will be measured with minimum clothing and without shoes using Omron model SPF 400 scale. So make sure you write the specific instrument that you are using. And then for the validity, we would say that the weighing scale will be calibrated to 0 every day to ensure that the measurement will be valid and reliable. For the height, participant will be measured without shoes while participants stand against a wall. Height will be measured using a measuring tape, and recorded to the nearest of 0.1 centimeter. So this is the kind of details that we are expecting. Again, for the biomedical information, we would say how we would measure all of these variables. So blood samples will be analyzed for HbA1c, fasting glucose, LDL, HDL, high density, cholesterol, triglyceride, and total cholesterol in the laboratory of DHQS. It's very important to mention where your biomedical samples are being analyzed. And then how the blood samples would be processed. So it will be collected using evacuated blood collection tubes. Participant will be asked to fast overnight. We will record the time of the blood draw and the most recent shift worked prior to the blood draw. And then we also give like what kind of lab technology we are using. So there might be a different technology, different kinds of technology used for testing or evaluating these biomedical information. So we will give the exact technology. For HbA1c, we're using boronate affinity chromatography. For fasting glucose, we are using this method. For LDL, SDL, we are using the elimination method. So, and then also give the references of each standard methods that you are using. This is an example to right? The validity and reliability for the lab assays, we are saying that the lab has high quality control materials, and then the lab also does the external quality control, which is arranged by the internationally recognized referenced laboratories that distribute batches of samples of various concentrations for each assay. The lab performs the external quality assurance scheme from unknown acid sample from Department of Clinical Biochemistry of CMC Vellore. So we would give that information how the external quality control was done, and then we also did internal quality validity and reliability. We additionally collected like 5% of the blood samples in duplicates and then sent for testing all parameters blinded to the laboratory personnel. So then we later compared those blood samples, and actually the correlation was very good in this lab. For the data management and quality assurance, think about flow of data. So for example, you would want to mention if you are collecting the data in electronic data form, then you can say that we will like extract it in our Excel sheet and then store it safely in the password protected computer. And then how will we ensure the quality of our data? This is what we did for ensuring the quality of data in our pioneer study. So we said that first, the electronic questionnaire will be closed only if data collection is complete to avoid partial or missing values. You all will receive training on designing electronic questionnaire using your Android phone or tablets or laptops. So encouraging you again to use electronic questionnaire rather than the paper-based questionnaire. And then the data will be cleaned and checked monthly, and answer fields for all integer variable will be constrained to ensure entry of only valid numbers. So for example, if we are asking like how many days a week do you drink milk, then if you enter 8, it will not, the system will not take it. It will say that this is invalid, just enter the valid number. So that's how also you can mm, mm, do some quality control. Second, the research assistant will receive intensive training on data collection and ethical consideration. This is a very important point. If you are hiring or having research interns or assistants, make sure that they are very well trained. Third, the site investigator will supervise the array on day-to-day basis. Very important to supervise your research assistant. And then fourth, the principal investigator will hold weekly meetings with the site investigator and if required with arrays. So these were the data management and data quality control mechanism that we took. For the data analysis plan, be clear about what is your outcome of interest, your dependent variables, your exposure of interest, independent variables, what are your other covariates, confounding variables, if there are any effect modifiers, you have to list there, what statistical test you will use, what statistical software you will use, and how will you present the data. So this is an example of data analysis plan. At the 18-month follow-up, we will compare mean HbA1c between intervention and control group using independent t-test, so statistical test here. This is our independent variable, whether the participant is getting in intervention or control. And this is our dependent variable, like mean HbA1c. So we also say that because this was a randomized control trial, we also mentioned that if the randomization did not control, then we would go for a multivariate linear regression model. And when you are using any regression model, then you have to mention like what variables are getting in the regression model. And again, don't use etc. Use the comprehensive, complete list of the variables that will go in your regression analysis and in which form. So for example, here we were saying intervention, yes or no, HbA1c level after adjusting for socio-demographic variable, age will be in years, gender will be like male or female or others, ethnicity will be like Brahmin, Kshatriya, Newar or others. So you want to make sure that you specify in which form your variables are getting in the model. And here one tip is that if your variables are biologically can be continuous, then do not break them into categorical variable. For example, age, don't make it less than 18 years or more than 18 years or 10 to 20, 20 to 30, 30 to 40. You can just use A's in years. Uh, like similarly, education, you can just use number of years of education. Don't need to make it primary, secondary, tertiary. Uh, the finer your variable, that will result in like better control for confounding. And again, if you have, if your variables are in continuous form, then the power would be higher if you treat them as continuous form compared to if you categorize them into different categories. But sometimes we, scientifically, it makes more sense to categorize variable. For example, BMI. It makes much more sense to categorize BMI as normal weight or overweight or obesity rather than just using it as a confounding variable or using it as a continuous variable. But even in that situation, if you are adjusting for BMI, I would still suggest you use continuous variable. But if the BMI is your dependent variable or independent variable, then you might want to think about whether you would want to categorize it into meaningful, scientific, meaningful way. And then we also mention what statistical softwares we are using and then give the reference. So here we're using SCADA 13. Sample size and power calculation will be covered in a separate single class. So I'm not covering this here. Always identify your limitations and report it early. Limitation in terms of study population, whether or not your study would be generalized in which kind of population. If you are doing study in urban population, then you might want to specify that, okay, this study has been conducted in urban setting and may not be generalizable to rural population. In terms of data collection techniques and tool, you might want to say that, okay, we used kind of this inferior tool because we didn't have like resources or time to use more refined tools. So there might be some kind of measurement error in our data collection. But and then also like make sure that what would be its implication in your study. You want to make sure that it does not have a huge implications in terms of conclusion or interpretation of results. And then if there is any limitations regarding the design. So I'm guessing that most of you would be using the cross-sectional study. So mention all of the limitations of cross-sectional study. Like for example, it cannot establish temporality because you are measuring both independent and independent variable at the same time. So make sure that you mention that. For example, if you are using a case control study, then make sure that there might be a recall bias in the case control study and how that recall bias will affect your study outcomes or study results. So here is the example of limitation. Minimization of contamination. The risk and level of contamination during the randomized study phase for the behavioral intervention will be monitored at the participant level. So we are acknowledging that this randomized control trial will have some contamination. So we say that, okay, we are going to monitor how much contamination is happening. And then the participation, and to like minimize the contamination, we said that the participants will be instructed not to share information about their study and not to provide any support to people in their work site other than their classmates. The behavior classes will be conducted in separate building outside of their work site to ensure the privacy. We will measure possible contamination by asking if the participant have received any information, advice regarding diet and physical lifestyle changes from any of their peers, and if they did collect the name and contact information of the peer. And if the contamination is found to be significant, we will make adjustment by adding the contamination as a variable in the final model while estimating the effect of in secondary analysis. So you can also like write what are the limitations and how you are going to minimize or limit those limitation in your study. So some writing tips: get organized and stay organized. Set a time frame, don't take forever to write. And then another like a big tip is, as a new researcher or new writer, you would always you always think that you want to learn more, or you want to like kind of have much more knowledge or broader knowledge before you write. But my suggestion is just go ahead and write, and it is okay to write imperfect draft, first draft, and then you can always go and refine. Use sections, subsections, and a sub of subsections, or sub of subsections. Like in the study population, we had like a subsection of inclusion criteria and then exclusion criteria. So like think of, you can use that hierarchical model. Use tables for list of variables, ideas, or procedures. Like you can summarize it much better in tables. Use figures for complex process. Give enough but not too much detail. Tie the study design and data collection to your study specific aims or specific objectives. Justify all decisions, and then balance science and feasibility. And it is very okay at this time to say that, okay, I'm doing this research in Tulikale because it is feasible for me. It is fine. But if the study has been like, if 100 studies has already been done in Tulikale, then that may not be justified. So you want to like balance both science and feasibility. And use generally accepted methods whenever possible and appropriate. These are two important resources. Strobe guideline, if you if you are planning to do an observational study, then go ahead and then refer to Strobe guideline. Both of these guidelines are available in our course website. And if you are doing intervention study, then look at the consort guideline. So these guidelines provide you the reporting. These are the reporting guidelines. So, for example, if you are doing a cross-section study or case control study, then this guideline will provide like what exactly you should report in background, or what exactly you should report in the study population or study design. So it is very helpful tool to organize your writing and making sure that you are not missing very important aspects of your proposal. And thank you all for today, and then I'll see you later next day with part 2 of research methodology that will focus on qualitative research design.